This is a video in clinical medicine from the New England Journal of Medicine.
Blood transfusion is a common procedure carried out by healthcare workers. The procedure is relatively safe, but complications, some of which are potentially life-threatening, can occur. Strict guidelines must be followed in order to minimize the possibility of complications. This video demonstrates a commonly used method for performing a non-emergency transfusion of red cells, also referred to as RBCs or packed red cells, in an awake, competent adult. The transfusion of other blood products, such as plasma and platelets, is not addressed in this video. The procedures presented in this video are based on the recommendations of the American Association of Blood Banks and follow commonly accepted guidelines in the United States, but recommendations may vary depending on the jurisdiction and institutional policies. The transfusion of red cells is indicated in anemia of any etiology when there is a need to increase the oxygen carrying capacity. Depending on the patient's symptoms, transfusion of red cells may be considered when hemoglobin concentration falls below 8 grams per deciliter. Generally, in adults, the transfusion of 1 unit of red cells raises the hemoglobin concentration by 1 gram per deciliter, the equivalent of raising the hematocrit by 3%. The items used for transfusion include the prescribed red cells, a patent intravenous or IV catheter, a sterile pyrogen-free white-type transfusion set with an appropriate filter, an IV pole, non-sterile gloves, normal saline solution, tubes in which to send a blood sample for analysis, and disinfectant pads. A stethoscope, a thermometer, and a sphygmomanometer are needed to assess the patient's vital signs. You should also obtain the patient's medical record, which can be a conventional paper record or an electronic medical record, depending on the institution, and a blood request form. The specific licensed practitioners authorized to order a blood transfusion or to perform the procedure may vary with local guidelines. Before you order the blood, explain to the patient the reason for the blood transfusion and the benefits and risks associated with the procedure. Then, obtain the patient's written consent. Ask the patient to provide his or her full name and date of birth or institutional record number. Confirm that this information matches the information on the patient's wristband. Also ensure that the information on the patient's wristband matches the information on the request form and the medical record. Obtain a sample of venous blood for compatibility testing. Ensure that the tube containing the blood sample is labeled with the patient's information and send the sample and the request form to the blood bank for analysis. The sample will be used to determine ABO and RH types and to screen for non-ABO antibodies. This process takes 30 minutes to 1 hour or more, depending on whether antibodies are detected on the initial screen. The patient's sample is then cross-matched with a compatible unit. After sending the blood sample and request form to the blood bank, document in the patient's medical record the indication for transfusion, the number of units of blood needed, the rate of infusion, and any special requirements, such as the need for irradiated blood. When you are ready to perform the transfusion, gather the necessary equipment. Confirm the patient's identity using 2 forms of patient identification and ensure that the patient understands the procedure. Wash your hands, put on gloves, and obtain venous access if it is not already in place. In patients with indwelling catheters, flush the venous access port with saline solution. Open the transfusion set and remove the cover from the bag containing saline solution. Close the clamp on the tubing. Remove the protective cover from the tubing spike and connect it to the saline bag. Hang the saline bag on the IV pole. Next, squeeze the chamber that is attached to the tubing to fill it halfway with saline. Open the clamp to allow the saline to flow through the tubing. Close the clamp when the fluid reaches the end of the tubing. Clean the IV access site or port with a disinfectant pad. Wait for the disinfectant to dry, and then connect the tubing to the patient's IV catheter. Open the clamp on the tubing to start the saline infusion. No more than an hour before starting the blood transfusion, obtain and record the patient's temperature, blood pressure, respiratory rate, and pulse rate. These vital signs will serve as a baseline for comparison throughout the transfusion. Administration of a unit of red cells must be initiated as soon as possible, but certainly within 20 to 30 minutes, depending on institutional guidelines, after it has been received from the blood bank, and the transfusion should be completed within 4 hours after the blood bag has been entered or spiked. When you are ready, call the blood bank to have the red cells delivered to the bedside. When the blood is available, wash your hands and put on gloves. In the presence of the patient and before you begin the transfusion, you must confirm that the correct blood product has been received. To do so, you and another authorized care provider must independently verify the patient's identity using 2 forms of patient identification mentioned previously: the patient's ABO and RH types, the donor's identification number, the donor's ABO and RH types, the interpretation of the cross-match test, and the expiration date of the blood unit. Examine the red cells. If there are any discrepancies or if the blood has an abnormal color or odor, clots or excessive air in the bag above the cells, signs of leakage such as a blood smear on the bag, notify the blood bank and wait until the issue has been resolved before proceeding with the transfusion. Once all information has been verified by you and the other care provider, both of you have to sign the tag on the blood bag before starting the transfusion. Wash your hands and put on new gloves. Hang the blood bag on the IV pole and spike the blood bag using the tubing. Fill the chamber of the tubing and adjust the clamp to achieve the prescribed flow rate. Record the start time of the transfusion and the donor identification number of the unit of blood about to be transfused to the patient in the medical record. During the first 15 minutes of transfusion, closely monitor the patient for any adverse effects. Instruct the patient to immediately report any symptoms such as pain, itching, rash, or chills. If a reaction occurs, several steps are required, including immediately stopping the transfusion, keeping the line open with saline solution, checking for clerical errors, calling the blood bank, and involving a transfusion medicine specialist. Further discussion about how to manage transfusion reactions is beyond the scope of this presentation. Assess vital signs 15 minutes after the start of the transfusion and at any time during the transfusion that assessment seems warranted, according to the patient's condition. Continue to monitor the patient approximately every 30 minutes during the remainder of the infusion. When the transfusion is complete, assess the patient's vital signs and compare them with the baseline measurements. If further transfusion is not prescribed, wash your hands and put on new gloves. Reconnect the patient's IV catheter to an IV fluid. Lock the catheter with a heparin or saline lock, or discontinue the infusion and remove the catheter altogether. Remove and discard your gloves. Wash your hands. Continue to monitor the patient for any adverse reactions for at least an hour after the transfusion. Explain to the patient that a delayed reaction may occur after transfusion, particularly in outpatients, and that it is necessary to contact a clinician and consider returning to the hospital if such a reaction occurs. Delayed symptoms, including fever, rash, difficulty breathing, and change in urine color, may occur days or weeks after the transfusion. Provide this information to the patient both orally and in written materials. Finally, document the procedure in the patient's medical record. Blood transfusion is associated with several potential complications, including febrile and urticarial reactions, acute hemolytic transfusion reactions, delayed hemolytic transfusion reactions, metabolic disturbances, and the transmission of disease. Blood transfusion is a common and relatively safe procedure. However, serious transfusion reactions can occur even when adhering to the recommended guidelines. Clinicians must be familiar with the indications for transfusion, the equipment required for the procedure, and the complications that may arise from this potentially life-saving therapy.